Hello, everyone.
This meeting is being recorded.
Hello, everyone. This is Dr. Siddharth Ambar from Chicago Arthritis and Rheumatoid Medicine. Welcome to our webinar today. Today, we are talking about our peptide therapy program for weight loss. As I am talking, please add in your questions and can either answer them as we go along, or I'll make sure to answer our frequently asked questions as well. If you're watching this in replay after it's been published, you can always contact us via our website, chicagoarthritis.com, or any of our social sites to ask any questions that you may have. Great. So today's talk, we're talking about our signature weight loss program, and we're talking about some of the newer peptide options. Just briefly about me, my name is Siddharth Ambar, physician here at Chicago Arthritis and Rheumatoid Medicine. We focus on treating a couple different things, including musculoskeletal issues, arthritis, tendonitis, injuries with non-surgical methods, as well as weight loss for metabolic health, which is so key in so many of our patients who are suffering from chronic inflammation, as well as joint issues as well. So obesity, we all know the scope of this. This is a very large problem and has really profound effects on cardiovascular health, metabolic health, immunologic function, and overall well-being. Just a humongous number of people that are affected by this worldwide, especially here in America, not only amongst adults, but also amongst children as well. So in this presentation, we're talking about our physician-assisted weight loss program, where we will go through how best to assist you with weight loss. So as I mentioned, the effects of obesity are very wide. From a musculoskeletal standpoint, we know that things like knees, hips, ankles, lower back, arthritis, and pains are dramatically worse if obesity is an issue. Certainly, issues like cardiovascular health, metabolic health, like diabetes, high blood pressure, are worsened. We also know that infection risk is higher if obesity is an issue. We also know that some autoimmune issues are worse, like psoriasis and psoriatic arthritis. Even some cancer risk is higher, and sleep apnea as well. So we need better weight loss solutions, in large part because obesity has not only long-term health problems, but also because we know that weight loss can help to mitigate a lot of those issues. And we know that traditional methods of weight loss, they're important, but they're not always working that well. Diet and exercise are 100% essential. They're just not adequate for most people. Conventional weight loss strategies can work, but they're also sometimes limited or unsustainable. And people end up on that yo-yo, kind of up and down with their weight loss. And the other thing is we realize that weight loss difficulty with weight loss is a complex issue, meaning there's biologic issues, psychological, and environmental factors. And we really need a plan that really hits all of those things. So our goals of treatment, besides actually just weight loss, are to improve your body composition in terms of reducing body fat, improving muscle mass, reducing visceral fat, improving your risk factors for cardiovascular health, improving your metabolic issues, improving your exercise capacity, improving your eating habits, improving your immune health, gut health, and even sleep and stress management. All these really tie together when it comes to just weight loss. So there's really 3 ways that diet can help with weight loss. To begin with, you can just eat less. You can reduce your total calories compared to your output. So less intake versus your output will lead to weight loss. You can also eat less of specific foods. The challenge is which foods. When you look in the population, you see people when it comes to weight loss who are doing everything possible, from the extremes of folks who are only doing the carnivore diet, where it's only really red meat once per day, to then people who are doing vegan no oil. It's such a wide spread of what people are doing. And partly that's because some people will do better with one rather than the other. There's genetic susceptibility and what kind of works for some people. And then part of it is also that we're not fully sure what is really necessarily what's ideal for any given person, given their other medical issues as well. And so a personalized approach is important. I can tell you on the medical side, what a lot of medical societies recommend is more of a Mediterranean diet, which tends to be more vegetables, more lean meats, less red meat, and obviously minimizing processed foods and sugars. That is generally a good approach because that probably works for most people and is probably a good suggestion for most people as well. And then there's eating only specific periods of time. So intermittent fasting is this idea of eating during a smaller window of time and fasting the rest of the time. There's benefits for that on the metabolic health in terms of improving blood sugar and helping with weight loss as well. Most common intermittent fasting period is 16-8, where you're fasting for 16 hours and open to eating for only 8 hours. So first meal maybe at 10 a.m., last meal at 6 p.m. There's a lot of utility to that. And I think when you take each one of these, less calories, less of specific foods, and specific periods of time to eat, all of these are useful when it comes to how weight loss can be better with your diet. All of those can actually be hastened or improved with some of the peptides that we're going to talk about. So peptides, they are naturally occurring molecules that act as signaling molecules in the body. What does that mean? It means that there are proteins in your body that are naturally there that tell your other cells what to do. So peptides are used to, the way that we utilize peptides is that we utilize them medically to emphasize pathways in your body that are helpful and reduce pathways in your body that are problematic. What's nice about this is that you're utilizing the body's normal and natural pathways that it's already utilizing that automatically, to some degree, will restrict how much of an effect you can get so that you don't overdo it, and tends to be better tolerated for the body as well, as opposed to sometimes medications that are more synthetic in nature. Definitely the future of medicine, and it is definitely available now. The most common, well-known peptide that you're hearing about right now are GLP-1 agonists. GLP-1 stands for glucagon-like peptide. It's a naturally occurring gut hormone, meaning this is a hormone that your body already has that helps to regulate appetite, insulin secretion, and energy metabolism. There are other peptide targets as well when it comes to that are similar to GLP-1s. GLP-1 is just the most well-known one at this time. Semaglutide, other name for that is Ozempic. GLP-1. There's tirzepatide that hits 2 different peptides, and then there's retatrutide, which affects 3 peptides. These are all available. They have a key role in glucose, your blood sugar homeostasis, and insulin secretion. Regulates your blood sugar and helps. Actually has a key role in diabetes and thus also metabolic health. So These peptides, the GLP-1 agonists, are the game changer in weight loss at this time. Semaglutide is a GLP-1 analog, mimics the effects of your naturally occurring GLP-1. Tremendous effect in terms of weight loss and improving metabolic health. Works for a few reasons. It helps by improving your body's control of blood sugar, meaning it takes blood sugar and helps your body absorb that into the muscles rather than having it just sit there in the bloodstream. It reduces how fast your body is processing food through your gut, and it reduces your appetite by actually reducing the naturally occurring hormones that your body has, neuropeptides that are associated with hunger, and increasing the neuropeptides that are associated with feeling full. And so reducing that hunger or food chatter. So semaglutide and tirzepatide are the two big ones right now that are available. They work by controlling your appetite and weight through that brain and gut kind of access, by slowing your body's transit of food through your system so you're not just feeling empty all the time, by reducing your hunger sensations, and by helping you feel fuller sooner, and by reducing food cravings, thoughts about food, or food preferences. Again, what we call food chatter. So these two peptides, semaglutide and tirzepatide, are formally approved for type 2 diabetes, formally approved by the FDA for type 2 diabetes, and for chronic weight management in the following people: folks who have a BMI of greater than 30, and folks who have a BMI of greater than 27 who also have another weight-related comorbid condition, which can include high blood pressure, diabetes, cholesterol, wear and tear arthritis, fatty liver, pre-diabetes, that's a key one, heartburn, PCOS, hypogonadism, and asthma. And so really a wide spectrum of people this can be appropriate for improving weight loss and improving metabolic health. Potential other future indications preventatively that a lot of us are curious about, not really ready to recommend this widespread, but you can see where the science is going, is how do we help people prevent heart disease who are at higher risk, pre-diabetes who are at higher risk, neurodegenerative diseases. There's a study out there that shows that this can be helpful in Alzheimer's disease. As an anti-aging product as well, how much of our aging is really due to metabolic progression, and then metabolic syndrome. Metabolic syndrome is where you have folks who have this terrible combination of high blood pressure, early diabetes, fatty liver, even elevated uric acid level and gout, and they have much higher rates of heart disease longer term. How do we prevent that? You'll actually see this. I'll see folks who've got early gout, right? That's part of my practice. And you'll see that they also have borderline blood pressure, borderline cholesterol. You can tell where they're headed. And these may be especially men who are in, let's say, their early 30s. And you can almost predict that if nothing is done to prevent this of progression, that they can have progression over the next 10 years or so. So how do we prevent that? Definitely need to do lifestyle changes, diet and exercise, but also consider GLP-1 agonists in that category. So the dosing protocol for the GLP-1 agonist, it's a weekly dosing. You're injecting yourself subcutaneously in the abdomen generally, or the thigh, once per week. We always start on a low dose and we escalate monthly as required. Monitor your weight monthly and observe for any potential side effects. I recommend checking your metabolic health labs at baseline and every 6 months to make sure things are being done and handled safely. The results in clinical studies is really quite tremendous. For example, for semaglutide, an average weight loss of about 15%, for tirzepatide, an average weight loss of about 20%. You combine this with nutrition and regular exercise, you can get really great maximum results. Do recommend, from a side effect profile, the most common side effects with these meds is some GI discomfort. For most people, if you start at a low dose and slowly go up, they'll tolerate it well. If as you're going up on the dosing, you're not quite tolerating it, you may have to adjust. You may have to slow down the escalation. For folks who are having difficulty tolerating semaglutide, tirzepatide can be better tolerated in some of those folks. And so there's always options. Outside of that, there's some other kind of GI side effects. In my experience, if you're managing this correctly as a physician, folks should not get those kind of bad side effects. Always potential for worse side effects, but pretty rare with these kind of medications. Lipotropics. These are another product that we'll utilize for weight loss, different than the GLP-1 agonists, but also a really nice option. These are substances that help to break down fat in the body and improve metabolism of fat. It's basically a series of vitamins, supplements, and amino acids that are listed there. Benefits are that they can improve energy level, liver detoxification, aiding in weight loss, and helping out with your overall metabolic health and immunity. You inject yourself once per week, intramuscular. Combined with peptides, you can get even better weight loss. This is milder than the GLP-1 agonist. Again, helpful for your metabolic health and with weight loss as well. The last bit that I'd recommend that we're going to talk about is health coaching. When you think about what we're trying to do here, we're really trying to effectuate very significant, not just weight loss numbers, but like life changes. Because with that weight loss, it will improve your overall health tremendously. And it can also help in a lot of other ways. So we work with an organization called Revolution PT and Weight Loss. They're our weight loss partner now as well. And I think improving nutrition with health coaching can be very key for a couple of reasons. Number one, education. I think when you're making changes, sometimes education, knowing what's the right thing to do is helpful. Sometimes you know it, but sometimes you need it to sort of be spelled out a little bit more directly. I think that helps. And then accountability is key. Accountability to make sure you're sticking with the plan is very essential. This idea that it can take about 60 to 90 days to create new habits. Education to know what's the right thing to do. And then from a practical standpoint, how do you lay it out? It's easy to say, don't eat XYZ and eat ABC, but how do you put that into your actual life? Like, how do you actually do that? Not an easy thing. And then the accountability to make sure you're sticking with the plan so that it becomes a habit is really key as well. So health coaching is very key, and we have a good partner in that regard. So the keys to optimized treatment, if you're using peptides and lipotropics, combine that with exercise and nutrition, that will help the most with weight loss. From a nutrition standpoint, you want to eat a nutrient-dense food. Don't be eating empty calories. You want to avoid overeating. Frankly, with the GLP-1 agonist, you will not be overeating. Like it helps. It will help you to prevent from that. It'll actually also help you make good food choices. It's one thing to say you know what the good food choices are. It's another thing to make those good food choices. And so good food choices can definitely be made, and this will help you from making those bad food choices. What we find is that a lot of addictive behaviors, whether it's food, alcohol, smoking, drugs, actually improve when people are on GLP-1 agonists, which is kind of a cool thing. And so eating the right food, much more likely with the GLP-1 agonist. And then exercise. Cardiovascular exercise to assist with weight loss and improve your metabolic health. So important to also do strength training to protect from muscle loss as well. And I'll talk about that in a moment. Some other peptides out there. There's growth hormone peptides that can help with boosting metabolism, increase fat burning, helping build lean muscle mass. There's another peptide called AOD 9604. Again, works in the growth hormone axis that can help with visceral fat, meaning around the abdomen. That's testosterone as well. So there's a few other options out there. With any of the peptides, safety first. Understand that these are best used under safe medical supervision. I realize that there are ways to get these kind of treatments online nowadays where there's very loose supervision, not much supervision. That's not the right way to do this. You really should have some proper medical supervision. Potential side effects, injection site reactions, blood sugar alteration. If your blood sugar runs on the slightly higher side, As you start to take these kind of treatments, the peptides, your blood sugar will drop. If you happen to be on diabetes medications, you need to be careful with that because your diabetes medications are making your blood sugar drop as well. So you just have to be aware of that to manage that properly. Nausea can occur with these meds. The GLP-1 agonists, you don't really see fluid retention or headaches, a little bit more with the growth hormone peptides. The key with all these is start low and slowly escalate. Again, safety first. Most of these treatments, the GLP-1 agonists, all have published evidence and safety data. Some of the growth hormone peptides, less published evidence, but there's a lot of physician experience. Just have to keep that in mind. Again, if you've got other severe medical issues, cancer, heart problems, other severe medical issues, your physician needs to know about that to guide you through this carefully. Again, work with a knowledgeable, experienced physician. Be aware that some of these treatments, an intermittent break or dosing cycles is needed. GLP-1 agonists, that is not the case. All right. In combining peptides, it's a possible option, newer concept, but I think that may be the future as well. Regulatory, understand that your physician needs to know about the regulatory issues here. What is FDA approved? What are the status of compound pharmacies? You can get things like semaglutide and tirzepatide as a brand name through the brand name version. Generally speaking, getting that for diabetes is possible, although you have to jump through a lot of hoops. Getting for weight loss, harder, sometimes much harder. So a lot of folks are getting through compounding pharmacies. Your physician needs to be aware of the safety dynamics to make sure you're getting treated safely, and needs to be aware that there's fluctuating regulatory compliance that the FDA will demand and require as well. So your physician needs to be aware of that. So this is one that comes up occasionally, but in the past, the FDA has sort of flagged compounding pharmacies for what kind of products they can utilize or provide. And so if you do lose your peptide therapy, you may have access to a brand name version, right? Higher cost, but that is an option. You may change to another peptide or peptide combination, or sometimes with the regulatory fluctuation, your peptide may come back online and be available again. Again, your physician should be able to guide you through that. Some frequently asked questions that I hear from patients all the time. How long before you see weight loss? We tell patients, look, there's a slow escalating phase for the first few months. Really for the first 3 months, but up to 6 months. You really have to give it at least 6 months. You should be noticing some early weight loss within the first couple of months, maybe even the first month, but you need to give it at least 6 months to really get a sense for how well is it working. You start on a low dose, slowly escalate. How much can you expect to lose? On average, you can expect to lose 15 to 20%. That's what the data shows with semaglutide and tirzepatide. How long do you need to be on treatment? Again, we recommend an initial period for at least 6 months. Studies show that with peptides, people do best with chronic weight loss management if they're on this long term. For folks who are need to be in this long term, a lower maintenance dose may be possible. That may be a lower dose or lower frequency. Be aware that some peptides may need to be cycled, so you may be on it for some time and off for some time. GLP-1 agonists, you're really best on it long term. So other questions. I had someone ask me this. Do you need to eat healthy and exercise on these medications? Yes, absolutely. That's how you get an optimal result. Mind you that the GLP-1 agonist can help you eat healthier because it'll help reduce that food chatter, reduce that urge to kind of eat unhealthier foods. And so will actually help you make those kind of proper eating habits. And with the health coaching, you'll know what to do as well with accountability. Can these treatments make your muscle and bones weaker? Semaglutide, tirzepatide, the GLP-1 agonist. Look, when you lose weight, your body will pull from fat and muscle. It's not really discriminating. So it's important for you to focus on body composition. That means resistance exercises. You have to do strengthening exercises. That's what helps maintain your body composition and your muscle mass. Optimize your nutrition, optimize your exercise to maintain muscle and bone health. When asked, suppose you don't eat too much, will treatment help? GLP-1 agonists, right, can still help metabolically. Lipotropics can definitely help. Some of the growth hormone peptides can help as well, still without affecting your actual appetite. Another common question: if you stop treatment, will you regain all the weight? look, if you stop treatment and you don't maintain appropriate exercise and dietary habits, you will regain the weight. So you have to maintain the exercise and nutrition. So should you use peptides long-term for the GLP-1 agonists? The studies show that you will do better in terms of weight loss and metabolic health if you take this long-term. And again, maintenance dosing, maybe lower dose, lower frequency. And then how do peptides compare to some of the prior weight loss meds? They're GLP-1 agonists. They're safer, more consistent with weight loss, and better weight loss. They're groundbreaking and really much better in terms of what we've had in the past medically for weight loss. So our comprehensive weight loss program, physician-assisted, physician-supervised, utilize the efficacy of peptides and lipotropics, thorough evaluation to begin with to make sure you're a proper candidate based on your medical history and weight loss goals, evaluated for any underlying health conditions. Expert management on our side, continuous monitoring and adjustment of treatment as required, regular lab monitor to make sure it's being done safely as well. If interested, there's our QR code. You can also go to chicagoarthritis.com to learn more. Again, contact us for our social sites if interested. There's the pricing for peptide therapy and lipotropics. Also, keep in mind, we have a summer 2025 discount for new signups, $50 off your first month, or if you sign up for a 3-month package, $200 off. Really great deal as well. Wonderful. Well, I will pause for a second, see if there's any questions. Keep in mind that if you're catching this after the live replay, understand that you'll see this on one of our social sites or on the website. And if you have questions, you can always contact us via the website, chicagoarthritis.com, or any of our social sites. Call us, email us, whatever works. And when you're ready to kind of go down that journey, we're here to help out. And until then, I hope everyone stays healthy and live well. Bye-bye.